All right, I guess we're ready to begin. Hello, everybody. I'm Mark Christ. I'm the head of adult programming for the Central Arkansas Library System. And tonight we have a program, Lung Cancer Screening in You. A few housekeeping things. You can put your questions in the chat, and we'll answer those at the end of the program. This program is being broadcast here on Zoom and also on our YouTube and our Facebook Live channels. It will be recorded and will be accessible on the Central Arkansas Library System YouTube channel after tonight. I also want to especially welcome our friends from AARP who are joining us tonight. And let me introduce our speaker. Sierra Whitbey is the Health Promotion Specialist for the American Lung Association and the Arkansas Tobacco Education Initiative. And she'll be presenting tonight on the importance of lung cancer screenings. The mission of the initiative is to improve the health status of all Arkansans by using evidence-based strategies through program initiatives, promotion of cessation services, and recommendations of smoke-free policies to reduce the use of all tobacco products, including electronic nicotine delivery systems within Arkansas. Excuse me. There will be a short post survey posted in the comments. I'll post that in a second. And it'll also be emailed to everyone after the presentation. If you would please take a couple of minutes to answer that survey, we would all appreciate it. And with that, I will turn it over to Sierra.
Hello, thank you for having me today. So I will talk about lung cancer screenings. Let me pull up my screen. Okay. So hello, and thank you so much for coming today. We're going to talk about an overview of what lung cancer screenings are and why they are so important. I also want to remind you that any in-depth or technical questions that you may have should be addressed with your doctor or another healthcare provider. But let's go ahead and look at our topics for today. So it is our hope that after today's presentation, you will understand more about what a lung cancer screening is and what the benefits are, and who should be getting a lung cancer screening. We will also show you why it is very important to increase lung cancer screenings in Arkansas. We will talk about the actual screening itself, as well as what you can expect at the screening, and talk about some risks associated with the screening. Okay, so you may ask or wonder why you haven't really heard of a lung cancer screening or a Lodo Ct Scan before. Well, it hasn't really been a super effective test in the past. Chest x-rays have been used in the past, but they have not been good at detecting early cancers. So another test was needed to provide a more detailed image. So to do this, doctors began using what is called a Lodo Ct Scan. The scan is done in a regular CT scanning machine, but with much less radiation that is used for the lung cancer screening. So in other words, the radiation dosage is turned down when used for this screening. A Lodo Ct Scan is a non-invasive test. It is used to detect early stages of cancer. There's no preparation, there's nothing to drink, no fasting of any sort. The Lodo Ct Scan produces a 3D image that is very detailed and can show early stage lung cancers that might be too small to be detected by a traditional x-ray. The Lodo Ct Scan can detect cancers the size of about a grain of rice, whereas our regular traditional x-rays, they were able to detect cancers the size of a dime. So a grain of rice compared to a dime, that's a big difference. The smaller the tumor detected, the less likely that the cancer cells have spread to the other parts of the body. And this means that there are more treatment options and a higher chance of survival. So now let's go ahead and look at the benefits. A lung cancer screening exam can find lung cancer in its early stages when it's still treatable, just as a mammogram can find breast cancer early. So with lung cancer, it's the #1 cause of cancer-related deaths in the United States and the second leading cause of death in Arkansas after heart disease. So mainly because the cancer is often not found until it is in the later stages, such as the 3rd or 4th stage when it is more aggressive and more advanced. In fact, the prognosis for survival is very low when this cancer progresses to 3 or 4, and it's why it's so important for you to get that annual Lodo Ct Scan. So who should be getting a lung cancer screening? Well, they're not for everyone. So really only those individuals who are at high risk for lung cancer should be getting this screening. So who is at risk and who should be getting it? Well, you must be between the ages of 50 to 80 years old and be a current smoker or a former smoker who has quit within the last 15 years. You must also have a smoking history of at least 20 pack years, which means you've smoked a pack a day for 20 years or 2 packs a day for 10 years. You must also be healthy enough to tolerate surgery, not be on oxygen, and have no recent cancer diagnosis. If you're not sure if you qualify, you can talk to your doctor or you can call one of our many screening centers across Arkansas and they should be able to help you. I'll also give you some more information later in the presentation on where you can find a screening site. Now let's go ahead and talk about what you can expect. So what happens before the screening? The actual screening is quite quick and painless, and it usually lasts about a minute to 5 minutes. There's no injections, IVs, or dyes that you need to take. You really can continue doing all of your daily routines, such as eating and drinking. And so it's really to say that a couple minutes could save your life. So just take that time and go get tested and checked. Now let's look at the procedure. So prior to getting in this Lodo Ct Scan, you will change into your exam gown, and then you will be asked to lie on your back on the table of the CT machine with your arms raised above your head. The table will then slowly pass through the center, and they will take 3D images of your lungs. It's important to stay very still during the scan to prevent any possible blurring of any images. You might even be asked to hold your breath to decrease this chance of blurring. While you're in the CT scan machine, you will hear a whirling sound as it just rotates around you. The scanner will cover your entire body for a short period of time, but both ends of the machine are completely open for you to be able to see and hear outside of. The physician or the technician performing can always see you and hear you. And like I said, the test is between 1 to 5 minutes, and you should be able to get your results in about a week. So really, it's very simple and easy. So now let's talk about results. As stated, the results from the Lodo Ct Scan usually take about a week. After the CT scan is completed, a follow-up appointment will be scheduled with your doctor to discuss any of the results in person. It should be noted, though, that abnormalities are common and that most are non-cancerous and harmless. So if the test is negative, your doctor may advise a yearly screening. If something is found, but there is no clear evidence of a possible cancer, then your doctor may have you come back in about a year or so. If the CT scan reveals something abnormal, you and the doctor will just discuss next steps in the process, including some further testing, repeat imaging, any of that. But the good news is that when lung cancer is found early, it is a lot easier to treat. So why is screening important? Well, like I've mentioned, lung cancer is the second most common cancer and the leading cause of cancer death in the US. And in 2020, lung cancer amounts for about 27% of all cancer deaths. The 5-year survival rate for all stages of lung cancer combined is just about 16%. However, for cases detected when the disease is still localized, that number is about 53%. The most important risk factor for lung cancer is smoking. Smoking is estimated to account for about 90% of all lung cancer cases, with a high risk of lung cancer approximately 20-fold higher in smokers than in non-lung smokers. Increasing age is also a risk factor for lung cancer. Median age of diagnosis is around 70 years old. Lung cancer generally has a poor prognosis unless caught in its early stages. So now that we know that lung cancer can save lives and that it's so important, let's talk about why we should be talking about this in Arkansas in general. Well, here we have the second highest death rate, and we as Arkansans rank 49th in the nation for lung cancer. So about over 1,700 people died from lung cancer in Arkansas in 2020. That is more than colorectal with 560, prostate with 430 cases, and breast cancer 390 cases all combined. So we currently have a low rate of lung cancer screenings. Therefore, it is important that we educate the public and healthcare providers of the benefits and availability of lung cancer screenings in Arkansas. The goal is to increase lung cancer screenings to help reduce the lung cancer death rate. So Arkansas has a scanning rate below the national average. We have 4% of those at high risk were screened, whereas national average is 6%. But we do have a higher than average smoking rate. So smoking is the highest risk for lung cancer. And yeah, Arkansas has about a smoking rate of 20%. So let's talk risks. There are some risks associated with diagnostic testing and treatment therapies that use radiation, such as your x-rays and your regular CT scans, as well as your Lodo Ct scans. For many diseases, these tests and therapies have reduced the need for surgery and have dramatically increased life expectancy. Although the radiation exposure from a Lodo Ct scan is higher than a typical x-ray, the benefits of receiving such a screening dramatically outweigh the risks of not having the screening, especially if lung cancer is detected or you are at a higher risk of developing lung cancer. All right, so what is the cost? Well, the Lodo Ct scans are recommended by the U.S. Preventative Services Task Force as a preventative test, and so it's now covered by Medicaid, Medicare, and most private insurance. So if you meet the criteria that is set out by this task force, the screening should be covered. Oops. Sorry about that. The screening should be covered. But unfortunately, uninsured individuals may have to find alternatives to get the screening. But luckily, there are some nonprofits that can help you pay for the screening, and some hospitals can have free or reduced rates for those who cannot pay due to lack of insurance. But in general, before you agree to any procedure, you should always make sure and talk with your doctor and confirm with your insurance provider. There are many hospitals and clinics in Arkansas that offer these lung cancer screenings. You can schedule an appointment via online or a phone call. You can also go through your doctor directly to talk it over, decide if you're a good candidate for lung cancer screening. You can also go to the American Lung website and type in your zip code and to find local facilities. So let's talk about what we've touched on. We've learned that lung cancer screenings can detect cancer in early stages when the cancer is still treatable. Detecting cancer in the early stages through lung cancer screening with the annual Lodo Ct scan for those at high risk can reduce the lung cancer death rate by up to 20%. The screening is quick and there is no preparation needed, and it is covered by most health insurance. It's important that Arkansans get screened since 2 out of every 10 adults in Arkansas smoke. You should talk with your doctor about the risks and the benefits of getting a lung cancer screening. The best way to prevent lung cancer is to never smoke or to stop smoking now. So if you are still smoking and you want to quit, you should call the Arkansas Be Well call center, which I will have more information on at the end of this. So some other resources that you might be interested in. There is a large amount of information for lung cancer patients and their families available at lung.org/lung cancer. Our content in that section covers mostly every topic you can think of associated with lung cancer. It comes in many forms, such as articles, videos, PDFs, and interactive infographics. You can also get involved with our awareness campaign called Lung Force. So if you have a connection to lung cancer, we would love for you to be able to share your story with us. We need to bring awareness to the disease, and so speaking up is the great first step. So if you are ready to quit tobacco, you can call the Be Well Arkansas Tobacco Quit Line or our Be Well Baby program if you are pregnant and ready to quit. You can get individualized tobacco cessation coaching for free. You can also receive free nicotine replacement therapy, also known as NRT. And if a Medicaid client, you can receive a 90-day prescription for NRT. The Be Well Baby program offers incentives to pregnant women to stop smoking while they are pregnant, and we will also help we will also help the mother remain tobacco-free after birth. So if you meet the requirements, make an appointment and have a lung cancer screening today. If you smoke, stop and call the Be Well Arkansas call center. You should tell anyone that you know about the benefits of lung cancer screenings. Most people don't know about it, and the information is very helpful and can save lives. Also, get involved. Lung Cancer Force is provided by the American Lung Association to give awareness, research, and education to everyone who may be impacted and can save more lives. So I hope you found my presentation helpful. And if you have any questions, I can answer them now. And we'll go ahead and stop sharing the screen. Perfect. All right. You're muted still.
I don't have any questions in the chat. Let me check our Facebook live feed. No, don't have any there either.
Sure.
So I guess we're good.
Okay, well, if anybody has any questions, you can email me at sierra.whitby@lung.org, and I'd love to discuss how we can help you quit, how we can present to your organizations or your community. You can always email me and I can get in touch with you.
And I'll mention again that this presentation will be on the Central Arkansas Library Systems YouTube channel. And I will be sending the link to the survey to folks who are registered for today's program, or you can pop in the chat right now, hit the link and answer it right now. So, well, Sierra, thank you very much for sharing this this information. It was certainly eye-opening on a variety of levels. And everybody go out there, if you need it, get your lung cancer screening. It might save your life or the life of someone you love.
Absolutely. Thank you so much. Y'all have a great day.
You too. Thank you, Carmen, for being our Zoom master tonight.
Thank you.